Good morning. Good morning. We will get started shortly. Waiting for a few viewers to join us. Good morning. Waiting for a few viewers to join us. My name is Des Wilson. I'm a producer with Reckon, and this is a new series we developed called Black with COVID. For those who are unaware, I was recently diagnosed and fought through COVID-19, tested negative over the past 2 weeks, completed my quarantine and self-isolation phases. And so I, since testing positive about a month ago, I have since tested negative twice. Some of my main symptoms were loss of taste and smell. I had extreme fatigue, as well as the dry cough. But since then, I've recovered my taste and smell, and haven't had the fatigue issues. But want to stress the severity of the virus. I have no clue how I caught it. I have no clue where I caught it from. None of the people close to me contracted it either. So we pretty much created this platform to be able to have the conversation and talk about the disparities that the Black community is facing with this virus. We are battling the virus at a disproportionate rate, and it has attacked the Black community at a disproportionate rate than other communities. And there are varying theories as to why, but there is no direct single explanation as to why this virus is affecting the Black community at a much higher rate than many others. The Latino community is also included in this conversation. The Latino community is also being disproportionately affected by this virus in terms of deaths. And so we wanted to create this platform so we can have this conversation and talk with other members of the African American and Latino community here pretty soon about their experience with battling the virus, their experience around testing, even what their testing process was like, where they tested, so we can share this information. Everyone is not directly plugged into the news cycle. Everyone's not on Facebook. So you may be able to share a testing location. There may be an experience that may help you or encourage you to continue to be safe and be vigilant, and to protect yourself from this virus and possibly provide some insight on what to do. If you do contract it, again, we're all dealing with this and learning how to navigate it as we move forward. So I want to bring on my first guest is Funny Mane Johnson. He also contracted the virus and has tested negative since contracting it, and remains negative now. I'll bring him on. Mr. Funny Mane, how you doing, bro?
I'm doing good, Dave. How you feeling?
Yeah, I'm good, man. It's I'm glad to be over at least what I think is the worst of it. I haven't had any symptoms for about 2 weeks. Right. Luckily recovered my taste and smell. But how you been?
I've been the same, man. Little to no symptoms during and after. Just the whole process. I went back and got retested twice, both nostrils, and make sure everything is good. And probably a week after, it hadn't even been a week. I just got my results back Wednesday. I got tested on Monday of last week. So, since then, man, still been keeping the routine, the regimen going. Definitely more cautious when I go out. Gloves, mask, got some plastic covers. Like, I'm not playing around. I don't want to be tested again. I want to be done with that.
Yeah. Where did you end up going and getting tested?
I got tested at 3 different locations, all 3 different experiences. The first time I got tested off Acton Road in Hoover at a private facility. This was when the testing first became available, tested negative. Then the second time in probably earlier this month when I tested positive, that was at UAB facilities up here on South Side. And then third time when they did both nostrils and had to go back, that was at Legion Field. So 3 different sites, 3 different adventures, 3 different times. It was, yeah, I don't want to do it again if I don't have to.
And do you have any idea where you may have contracted it, or how did anyone else around you contracted at any point?
No clue, man. I wash my hands consistently. Always, I have a mask in all my vehicles. Got gloves in there, so I'm usually good about it. The only date that I've been able to possibly think of would be this Juneteenth rally that I attended that night, and I did, just to talk to some of the people. I kind of took my mask off just to, I wouldn't say politic or campaign, but just talking to the people, some other stuff that we're trying to do in the city. Had some great conversations, but it was a lot of mouth, a lot of closeness and a few hugs. So that could have been the night that I contracted it.
Yeah, for me personally, man, I really have no clue. I have, at the time I have been more vigilant around washing my hands than I was with wearing a mask. And so for like little short trips of just running inside the gas station and stuff like that, I'd leave my mask in the car, just not really even thinking about it. But if I was going somewhere like a grocery store, then I'd mask up. But I was keeping hand sanitizer on me. I was washing my hands as much as as much as I could. I've got about a 9.5-month-old daughter now, so I was trying to be as hygienic, as I could, and still contracted it. And again, no one around me contracted it, so I really wasn't able to kind of pinpoint it. You probably got the same call from the health department trying to track your movements. Did you get that same?
Not well. There was a follow up this last time before I got my results. There was like a same day follow up, so I guess that was kind of a tracking thing. But after I contracted it, I turned on the Google stuff on my phone. So I'm hoping that info could help them, kind of do some tracing, tracking, or whatever. Plus, I got nothing to hide, so I turned it on. I turn it off when I feel like I need to.
Yeah, man. One of the things I wanted to pull up here, this is a recently released article by Bloomberg with some data that has been pulled from Johns Hopkins University, the Census Bureau, and CDC data. And so this article was released just a few hours ago, actually, that the COVID death rate in majority Black counties is actually getting worse. And so we've heard that this is disproportionately affecting the Black community. That's one of the reasons why this was kind of developed. Again, this myself, Funny Mane, and Jermaine, who's a firefighter, who kind of got a little busy, but he may end up joining us before this is over. The three of us, we started off in a group chat and to share each other's experiences around battling COVID at the time. Since then, all three of us have tested negative. But the overarching issue is that the virus is disproportionately affecting primarily Black and Latino communities. In this data here, there's also a data graph here that will kind of help put it in perspective, how serious this is. And some of the data points that this mentions, in counties where the majority of residents are Black, the death rate has climbed to 3.5 times the national average, up roughly 3 times as high in May. In places where Black people exceed 13% of the population, which is the proportion that we make up of the U.S., the death rate is double the national average. In places with more than 100 deaths, Black Americans have made up 23%. According to CDC data, this is almost twice of our share of the national population. And federal statistics on 1.5 million coronavirus patients, obtained by the New York Times, showed that Black and Latino people who contract the virus have been twice as likely to die. And theories around why this are very, things have been discussed like comorbidities, diabetes, obesity, some of these things having their own effect in terms of how the virus is affecting the Black community. In addition to, we know, access to healthcare, access to healthy foods, all these things, could very well be contributing, but there hasn't been one primary indicator to determine what or why this has been affecting the Black community. But I know one of the things that we've seen just even here in Birmingham is that many folks in the Black community still may not be taking it as serious as we need to. I know I've seen a lot of parties still going on, still seeing a lot of packed clubs. What about you, Jermaine? Have you seen this kind of same thing going on?
For a while I did, and I still get invited to some parties. This was just shocking to me to learn that people were so addicted to just having to go out and needing to be, at parties. I get it. It's fun. It's great. But, we're all in a different situation now. So you have to take that into account first. I don't think anybody should be a hermit, and just, lock themselves away. But even wanting to be in big crowds right now, like, I don't understand it, but, people are. I was very proud of my community here in North Birmingham as I got a chance to get back out since testing negative and go to different stores and even the post office. The older Black generation, like 50 up, they're really taking this thing serious. Like they have locked in. Everybody's got a mask. Some of them, I saw their dishwashing gloves on, but it is what it is. They're doing the 6 feet thing, and they've really bought in, and they're being very, very cautious. My generation and younger, everybody's still, coming up with excuses to mentally, tell themselves it's okay to keep doing what they're doing. And I just think that's very dangerous and selfish, if we're being honest. I get it. Everybody wants to have a good time, but it's a pandemic, y'all. It's a once in a lifetime thing, hopefully. But you got to put the brunches on hold, let the mimosas go for a minute, find creative ways to celebrate your birthday. Just, if I get any message I can get to anybody, this is not the time to be selfish. You really might only get one chance to get this thing right for you or your family members. We can't wait until somebody is hooked up to a respirator on a hospital bed and we're like, oops, I should have, would have. We don't want to do that. So let's be overly proactive about, attacking this thing so that, we don't have to keep seeing these numbers rise. We don't have to bury anybody. It's that serious.
Yeah, it really is. I've got a friend of mine, Kelly Griffin, who was recently diagnosed with COVID. I'm gonna bring Kelly on now. Hey, Kelly, you there? Kelly?
I had a mic off.
Hey, Kelly, you there? All right, I'm gonna try to wait for Kelly to get situated. But that was one of the things. I'm going to keep the series going. We're going to bring on some more guests. I wanted to recap from the first episode with Funny Man.
Yeah, I'm here.
Hey, Kelly, how you doing? Hey, Kelly.
Can you hear me?
Yep, we can hear you. How you feeling?
You can hear me now?
Yeah, we can hear you. How you feeling?
I'm feeling a lot better, actually. I said I'm feeling a lot better, actually.
And when did you first test positive, Kelly?
June the 26th.
June 26th
is when I first tested positive. Yeah, I was so that was a Friday, but Wednesday night I started. I was fine all day Wednesday, but that night I started clearing my throat. Like all night. And I said, damn, I don't know if I can cuss right. But I said, man, I don't, hopefully, when I wake up, it's gone.
Mm-hmm.
But when I woke up the next morning, that little feeling was still there. But at that time, I hadn't had a fever or anything like that. So I ran some errands, and then when I was out for about an hour and a half, I started getting real sleepy. I was like, I gotta go home and take a nap real quick. And so I went home, went to sleep, woke up. I had the chills. I had a fever. My fever had got up to like 103. What else? When I woke up, I was drenched in sweat. I was sweating real bad. I'm sorry.
No, it's all good.
What else? But I had a cough, and then my cough came. So my cough came, I was spitting up mucus and all that. It just happened all within a few hours on Thursday. All those symptoms came at once. And so I got tested Friday. I went to sleep. Got tested the next day, and I tested positive.
And I was going to say that's kind of been one of the similarities that I've heard is that the symptoms have come on real fast. For the majority of people, like it'll start off you kind of thinking it may be like a little cold or allergies or sinuses, and then boom, you're hit with all these, with the fatigue, with the other symptoms within like 12 hours, really, but I think you tested positive about 2 weeks ago, but then took another test expecting to be negative, and that one came back positive as well, right?
Right. So actually the day I went and got tested, the health department, they had been calling me, every so often. So she called me on my 15th day, and she said, she was asking me what my symptoms were. I said, I don't have any anymore. I said, right now I don't have any. And she said, she was just talking, and she said, well, I'm going to go ahead and lift your quarantine. I said, well, I went and got tested again today. My results have not came back yet. And she was saying, well, okay, I'm still going to lift your quarantine. You don't have any symptoms right now. She said, but if you want, she said you can quarantine for at least another 5 days. Just to be on the safe side. And so when I got my results, they came back positive. And she said that so I called her back and I said, well, hey, my test came back positive. Well, now she said, well, from the research we've been gathering, a lot of people will test positive even weeks after their symptoms have subsided. So, that's just the thing. And, so I said, well, I start work on the 20th. What do I do? And she said, well, like I said, if you want to quarantine for another 5 more days, you can just go ahead and do that. And but I wouldn't do it past then because it's unnecessary. So I called my supervisor because I was supposed to start work on July the 6th. So I called my supervisor and I told her that I tested positive again. And she said, well, as long as you've quarantined for those 14 days, you're asymptomatic, you're going to be good to start work. She said, because what it's called is called a persistent positive. She said the screenings, they test for dead and alive COVID cells. So if you have dead COVID cells or alive COVID cells, you're going to test positive. And she said they're called persistent positives. So, she said, most of our employees, if they test positive, we send them home and quarantine for those 14 days. And as long as they're asymptomatic, they can come on back to work.
And Kelly, you're currently in nursing school, right?
Well, yeah, I'm nursing, yeah.
You're currently in nursing school. And
no, I'm in nursing school. So I'm a nurse now. So.
You're officially a nurse. Congratulations.
Congrats.
Yeah.
Well, that's what's up.
Yeah, thank you. Thank you.
What have been one of the things nurses kind of have been discussing in terms of prevention and protection?
Keeping your hands washed, staying out of your face, keeping your mask on. We basically, when I was doing my preceptorship, we could never take our mask off. So we have that's 12 hours. We got our mask on 12 straight hours. We will always have to glove up, every time we go into a patient's room anyway. So that was already the norm. But it's just, the hand sanitizer is outside, in and outside of the rooms. We use that constantly. But that was something that we were always taught during nursing school to do anyway before COVID. So, but the most drastic change is wearing those masks for 12 hours straight. Not being able to take them off when we're not in a patient room. We have to keep them on.
Yeah, I'm sure. I have to sneak a breath in sometimes when nobody's around.
Yeah.
It's hard.
Yeah.
It's uncomfortable, but it's definitely not more uncomfortable than having to fight this virus. So you guys, again, if you're just tuning in, you're speaking with three people who have contracted and fought through, currently still fighting through COVID-19, who have no idea where we contracted it from, and we're unable to trace, back to any exposure, even down to no one else around us having tested either. So again, we're here to discuss it and discuss how it has disproportionately affected the Black community in America, specifically hard. And Kelly Griffin is a nurse who has also tested positive and is currently fighting in her kind of last round of fighting with COVID. So Kelly, I want to appreciate you coming on. I know you weren't feeling well this morning, so thank you for still making it. One of the things I'm going to do in the next episodes, in the future, are bring on some doctors, other nurses, to talk about the health risks and comorbidities that could be contributing to the disproportionate effect that the virus is having on the Black community. We know that.
Des, what was that C word?
Comorbidities. Yeah, co-morbidities. And it's been thrown around a lot. A lot of people, don't know what that is, but those are pre-existing conditions that, can contribute to your death in the case of something else happening. Those could be upper respiratory issues. That could be asthma. That could be diabetes. That could be, being overweight. And so one of the theories is that these comorbidities are contributing to the higher death rate in the Black community. But again, there's several theories that haven't been able to be pinpointed down to exactly what that cause is that is, affecting, why it's affecting the Black community and the Latino Hispanic communities as well. But we wanted to come here and discuss that, and moving forward, we'll dive deeper into some of the data. Again, we spoke about the Bloomberg report that came out this morning that features data from the Johns Hopkins University and CDC that shows how these deaths have affected the African American population per 100,000 people. So, and Dr. Fauci even has a very prominent quote when addressing Congress about what those pre-existing conditions could be, and even made the statement that systemic institutional racism has had an effect on that. So, definitely intend to explore that statement more. And also, even Bill Nye has a video out now debunking and explaining the importance of wearing a mask and how even wearing a cloth mask can stop the spread of these droplets that can easily infect somebody just from talking. When you're talking, you may accidentally, kind of spit a little bit, and when you breathe hard, when you cough, when you sneeze. So want to reinforce and reassert the importance of wearing your face mask. Again, you're talking to three people who contracted and have no idea how we caught it, even with being safe and being careful. So again, I was going to wait for Jermaine to come on. I think he's got tied up. He might be putting out a fire somewhere. But I think one of the other kind of unstated things about this is like the mental state of people who have had to contract the virus. And Kelly, I know you have kids. I have a newborn. Funny man, I don't think you have any kids yet, but you do. You've got a large family. You got a lot of friends. I know that it affected me a lot, having to be quarantined and dealing with the feelings of ostracization and like, you know, people being afraid to come in contact. That was new for me, you know, and I had to go through my own kind of level of understanding with that, and wasn't able to see my daughter for about 3 weeks. Kelly, how have you been managing that through this process?
Well, same. I haven't seen my kids for almost 3 weeks now. My mom, you know, she had breast cancer, so you know she really can't be around me because of the immunosuppression pills that she takes. But I was alone for about a week. My sister, she went and tested the same day I did.
Hey,
You know,
Kelly,
had been around her.
you may have to come a little closer to the mic.
Okay. Can you hear me?
Yeah.
Okay. So my sister, she tested the same day I did on June 26th. No, it was June 25th. I'm sorry, not June 26th. But she tested negative, and I'm like, you know, we had been around each other all week, so I that was confusing to me.
Mm-hmm.
And but she was like, you know, I just don't feel right, you know. And she was like, well, maybe it's all in my head because I know that you tested positive, so I'm just nervous.
Mm-hmm.
So she kept saying she just didn't feel well, but I was still quarantining by myself. And but she was around my brother, and she went and got tested again like 7 days later, and she tested positive, and so did he. So then, you know, I wasn't quarantining by myself anymore. But that first week, it was rough because when my son, he tested negative, which is good. My mom did as well. So at first it was rough because I'm like, you know, how did you? I just didn't understand. Like I couldn't believe that I caught it, and I had been keeping my hands washed. And I was lax with the mask, so it was like I knew you know what chances I was taking, but you know, being by myself and everybody acting like you know, I had the plague or something. It was tough. Because remember, I called you. Well, you actually called me after your first live, and I was like, man, I'm just, I don't know if I can deal with this by myself.
Yes, it's a lot, and a lot of people are suffering this violence. You know, and I think that's the importance of us maintaining this communication. You know, a lot of people have reached out to me in my inbox who are afraid to even, you know, publicize the fact that they contracted it, afraid to publicize that they caught it and beat it, you know. And I think there's some like, legitimate, you know, reservations around that because there is a public stigma around it that needs to be dispelled. You know, it's not leprosy, you know, it's not, it's, you know, it's not a flesh eating bacteria. And that's not to dilute, you know, the severity of this virus. Is killing a lot of people, especially a lot of our own people. And we need to be more vigilant in terms of how we address this and how we deal with it. But we can't do that if we don't talk about it, you know. And you know, we know that reading these news articles and that it's uncomfortable, and there is a bit of detachment from it until it comes home and it hits you on your front door, you know.
To that point, Dave, I think what I've learned through this process is that one of the biggest underlying conditions in our community is shame. You know, people were walking around with symptoms, and then when I, you know, announced that I had it, then my inbox blew up. Man, I've been experiencing this. What were you going through? That it's like, y'all, why were you not gonna say something to, you know, check on your own health? But I think historically we've done that same thing with STDs and just getting physicals and everything. So shame is causing a lot of people to not go get tested and checked, and they're just dealing with these symptoms and brushing it off. You know, sometimes we like to self-diagnose. I say, I cough all the time. I got sinuses, this and that. No, go get tested. Know for sure you could save your life and a lot of other people's lives.
Yeah, since I had it, I know so many people that have it now and has had it. I have a sister in Detroit, and she just I know she has it. She just went and got tested the other day, but she had the same symptoms I had, and she couldn't taste or smell. And she like, no, I don't got it. I was like, no, you have it. You know what I mean? And she was supposed to have a barbecue this weekend that just passed. And I said, you got to cancel it. You know, you can't, there's no way you're going to be able to, do that. And I know that the symptoms that you're having, so it's just like she was in denial for a minute, but she, went ahead and got tested. I had a cousin that had it, and he had it early in March, like when it first started hitting over here. And he's a Marine, and he's very healthy, fit, but his kidney started shutting down. He started having so many problems. And I can remember when he got better, he came down to visit in May, and he had some water, but I didn't see that he didn't drink out of it. He poured it in a cup. I was thirsty, so he was like, here, you can have this. And I'm like, you know what I mean?
Mm-hmm.
I was like, I don't know if I but
now's not the time to be passing drinks.
Yeah.
It's trying to share nothing.
But it was just the fact, like, I know that he had it. I did, so it was, it's I know a lot of people that have it now, like a lot of people.
Yeah, no, you're absolutely right. I'm looking at some of these comments. I'm gonna try to keep this. I was gonna try to keep it down to 30 minutes, but it looks like we've got a few people with some questions here. Carrie Nichols asked, "Funny man, have your symptoms been severe? You and Des both look like you feel okay, but that can be deceiving." Carrie, you're absolutely right. The virus is affecting different people in different ways. For me, it first felt like like I had some sinus issues, but then what really drove me to get tested was I completely lost my taste and smell. And other than fatigue, I didn't have very many issues. I think I had a headache and some dry coughing, but my symptoms were pretty mild, as opposed to a friend of ours, another Jermaine. He, out of the three of us, it hit him probably the worst. He had the breathing issues. He had the lung pressure, chest pressure, and congestion. But again, and Kelly tested again after her 2-week quarantine, and she was still positive. And so in some cases, we're seeing that even after symptoms have subsided, that the virus is still remaining dormant and that it still can be passed, even after you're not showing any symptoms and after you feel okay.
And I think she touched on something saying that, her, I believe her relative who was a Marine caught it very badly. And Jermaine, other Jermaine that sounds bad, but that's a
I know, right?
Jermaine, firefighter, very fit, works out more than either of us.
Yeah, absolutely.
So that is not a factor. Is not about your youth or your how much you exercise. I imagine ultimately that those things could help in the fight, but to see that was like the fifth person I knew that works out all the time, and I got a vegan friend who caught COVID. So I would say there's just no telling how your body is going to react to coronavirus. So I would encourage everybody to stay on top of it, get tested, know your status, and just mentally act like you have it and treat it before you know you have it.
Yeah, that was one of the things when Kelly called me, and by no means I'm not an expert on any of this. We're not giving out any advice. We're just discussing our experience. But one of the things Kelly called me when she first called me and mentioned that she was having some symptoms, that was the first thing I told her, was like, listen, just treat it like you got it. Before you even test, before you wait for your test, just treat it like you got it. Quarantine yourself, keep your distance, because there's no telling if you do or don't. But that's what we're seeing. So again, we're going to keep this going. Right now, it's every Monday at 11 a.m. I'll be bringing on more guests as we keep it going, some expert opinions. We'll have a data analysis where we can start diving into some of these numbers and looking at some of the counties that are being highly affected in terms of COVID-related deaths. But again, I want to thank you guys for coming on here. Thank you for the people watching, the people who've commented saying that they're appreciative of us sharing this experience in the platform. Hopefully we can help motivate other people to get tested and to help dispel the stigmas around contracting this virus, around helping prevent the spread of it. Again, this has hit the entire globe, and you shouldn't feel ashamed to discuss it. If you have any questions, feel free to contact any one of us, and we can helpfully, help you, make it through this. So I want to thank you guys for coming on. Again, we'll be here again next Monday at 11 a.m. And thanks for tuning in.
No problem, Des.
Thank you.
All right, y'all. See y'all later.
All right, bye.